Well, I am Crispine Indahl from Western Wisconsin Health. I am a certified diabetes educator, and I'm with Dr. Lau today, and we are speaking to you about pre-diabetes. Pre means before, and so what we know about pre-diabetes is that it can exist for 10 to 20 years before you're diagnosed as diabetic. Why should we be concerned about that? Well, it prevents you from developing type 2 if we can turn pre-diabetes back to normal. It can prevent heart disease for you. The problems with letting this progress is that we know we will see diabetes. And so this is your time to turn it around. The earlier we find pre-diabetes, the better. Dr. Lau, there is a lot of diabetes.
Yeah.
Can you talk a bit about the prevalence?
Yeah, so unfortunately, diabetes and pre-diabetes both affect our population greatly. So there's estimated that there's around 34 million people with diagnosis of type 2 diabetes, and that is too much. And it's estimated about 1 in every 10 people have type 2 diabetes. There are even more people with pre-diabetes, 88 million, and there's about 1 in 3 people, which is a significant number if you think about it. Yeah.
Just look at the lobby, in 10 people,
Yeah.
1 has diabetes,
Yeah.
in 3, somebody has pre-diabetes. How do you know if you have pre-diabetes?
Right. So there are several ways to check if you have diabetes or pre-diabetes. One of the tests involves checking something called hemoglobin A1C, which is actually a measure of how much your red blood cell takes up glucose in the past 3 months. So this test is very accurate. It doesn't require fasting. Okay, although there are caveats, but the most important thing you have to remember is it doesn't require fasting, and it basically records the amount of blood sugar in your body for the past 3 months. So an A1C of 5.4 to 6.4 is considered pre-diabetes, and more than 6.4 is considered type 2 diabetes.
And who could be moving into pre-diabetes?
Right. So the risk factor for pre-diabetes are overweight or obesity, sedentary lifestyle, smoking, and of course family history. So if you have any of these conditions, it will be best to screen for diabetes. Yeah.
And there is a community education class that we do for $10 a visit to help explain pre-diabetes to people and show them what helps to turn this around. The one thing you should know is that you have a lot of power in pre-diabetes. Simple life changes like eating a little better or a little less, working on weight loss and exercise, stopping smoking, these are things that are habits that we just need to work on. Several years ago, I met a gentleman that came to this clinic. He was the youngest of 9 people, and he had his own in-home office, and in there he put a treadmill and an Airdyne bike. He did the treadmill 20 minutes a day and the bike 45 minutes a day. All his brothers and sisters developed type 2 when they were about 50. When he came, he had slipped on the ice in January and wrenched his knee. So he could no longer use his bike or his treadmill. They didn't replace knees so handily right then. He was in pain, and his last daughter was getting married. His A1C was 6.8, 20 years after his brothers and sisters had been diagnosed with diabetes. So if that accident had not happened, he would still be controlling his blood sugar, putting that sugar into the cells, not leaving it in the bloodstream yet.
Right.
So you do have power.
Yeah, I would like to add to that. A lot of people have the misconception that having a diagnosis of pre-diabetes or diabetes is the end of they thought that this is the end of the road, but actually, like Chris said, this is not. You have a lot of power to change this, and you can still. I want to emphasize the main point is that you can still enjoy your life, continue to do the activities that you love to do, and continue to eat many food, enjoy many food. And another point is losing weight actually helps a lot with reversing prediabetes or help getting your blood sugar under control, preventing diabetes. In fact, every 2.2 pounds loss in weight has been shown to reduce the risk of diabetes by 16%.